Good morning and good afternoon. If you're joining us from the West Coast, we want to welcome you to our orientation session for our state licensing board users. We're going to get going in just a moment here. We have some slides for you to take a look at. First, I wanted to introduce my colleagues who will be presenting today as well. We have Dave Loewenstein here and also my colleague Molly Wirick. So we're going to be tag teaming the presentation today. So the purpose of today's webinar is to introduce state licensing and certification boards to the National Practitioner Data Bank, or simply the Data Bank. If you're attending and not from a state licensing or certification board, some of the material may not apply to you. Since the main audience today is state licensing and certification boards, that will be our primary focus. So this webinar is also in response to a number of requests that we've received from state boards for orientation type information for new staff or staff that may have turned over. So our aim is for you to leave the webinar with a broad understanding of what the data bank is and have some specific understandings of things more focused on your day-to-day tasks, such as administrative functions of the data bank, reporting to the data bank, and querying from the data bank. So without further ado, let's get on and look at an overview. Here's an overview of our topics today. We'll be going over getting started with the data bank, how you report, talking a little bit about compliance reviews, querying. We'll talk about report forwarding, tell you about some exciting system updates we have scheduled, and talk about website resources, additional topics, and how to get help and contact us. So the data bank operates under the authority of 3 statutes, Title IV, which is the Healthcare Quality Improvement Act of 1986, Section 1921 of the Social Security Act, the Medicare and Medicaid Patient and Protection and Program Protection Act of 1987, and Section 1128E. That's the Health Insurance Portability and Accountability Act. So the purpose and ultimate goals of the data bank is to promote healthcare quality, protect patient safety, and deter fraud and abuse in the healthcare system. The intent of the data bank is to primarily serve as an alert or flagging system intended to facilitate a comprehensive review of the professional credentials of healthcare practitioners, healthcare entities, and providers and suppliers. The information from the data bank should be used in conjunction with, not as a replacement for, information from other sources. In May 2013, many of you will remember there was a merger among 2 separate but similar data banks, and information about the merger is available on our website under Resources. You might be asking yourself, what does that mean and why should I care? The actions your board or agency takes on practitioners, healthcare entities, or suppliers must be available for queryers who may be querying on them for employment, contract, health plan service participation, etc. So with that information, without that information, without those reports, queryers will not get a complete picture of the practitioner, the entity, or the supplier. In other words, bad data in is bad data out, or no data in is no data out. In any event, the goals of the data bank cannot be fully realized if reportable information is not reported by you. So this is just an official statement about our vision and mission here at the data banks, but it is our vision to be a nationally recognized leader and partner in improving healthcare quality and patient safety. And our mission is to collect and provide information in a timely and accurate way on the nation's healthcare practitioners, providers, and suppliers to improve healthcare quality, promote patient safety, and deter fraud and abuse. So let's get started with the data bank. A few key roles of the data bank users are certifying official. You'll see that at the top. This is an individual selected and empowered by an organization to certify the legitimacy of registration for participation in the data bank. In a nutshell, this person certifies that the administrator and users are who they say they are and have the authority to use the data bank. The administrator role, this is a person who has ultimate responsibility for the board's account. The administrator can add and delete users, restrict user access, such as one user can query and another user can report, or just see billing information. So there's some different options that the administrator has to assign roles. Then users, these are people who generally handle the day-to-day tasks such as reporting, attesting, responding to our compliance efforts. And a board may have one or more users. For example, we've seen some boards with a user responsible for one or more professions, with other users responsible for other professions. In some cases, the user is also the administrator. The important thing to remember is that your account is private and needs to be kept up to date. So if registered users are no longer employed with the board, they should be removed. If the administrator changes, that information should also be updated on our website. If someone leaves the board or agency, it's never acceptable to share or have others use your information to access the data bank. I want to say a word about agents. Reporting agents represent other entities that have the authority to query or report on behalf of another entity, and we work with a number of agents. They must also be registered with the data bank. For example, the Federation of Chiropractic Licensing Boards is the agent for many chiropractic boards. The Federation can report on behalf of the board. The board, through its profile, establishes the relationship with the agent. Ultimately, however, the board is responsible for what is reported and what information is obtained from the data bank through queries. So now we want to show you some functions within the data bank. Get to the next slide. So here's this is a screenshot right from the website, and this slide shows the administrator functions after logging into the data bank. This menu is not viewable to the user unless the user is also the administrator and logs in as the administrator. So I want to point out a couple selections you can make on this screen. Those are highlighted in red there, but one is maintain user accounts, and the other is maintain agent information. So the maintain user accounts piece, this is a button that you select when you want to add, delete, or update or edit your user accounts. And then the maintain agent information, this is the button you select when you want to establish a relationship or cancel a relationship with an authorized reporting or querying agent. This next screenshot you'll see here, you see how the administrator can assign user roles. Each user needs a user ID and a valid email address. The roles are selected based on what role the administrator wants the user to have: query, report, billing information, or administrator. Once the account is established, the administrator can manage the account online and doesn't require mailing in paper or notarizing anything to manage their users. You can have multiple people assigned as administrators. Here we see the screen after you select the button Maintain Agent Information. If your board already has a relationship established with an agent or agents, that information will show up. If you don't have a relationship with an agent, you can select the link List of Agents to select the agent you are interested in using. Boards will want to take a careful look at what you want the agent to do. You will need to consider what access to the system on your behalf you want to give the agent in order to serve you most effectively and most appropriately. Okay, so let me introduce my colleague Molly Wirick, who's going to take us through the next piece. And Molly, go ahead.
Okay, thanks. I'm going to be talking now about reporting to the data bank. And I'm going to be going through a couple of different topics having to do with submitting reports, types of actions that get reported, types of reports that you'll submit, when reports must be submitted, how reports are submitted. So really, since most of you with state licensing boards interact with the data bank almost exclusively as reporters and not queryers, this is really the meat and potatoes of your interaction and relationship with us. So there are four main types of actions that licensing or certification boards will take. Now, actually, I want to pause here for just a minute. I'm going to probably use the term licensing boards. When we talk about licensing boards, we really mean boards that license, certify, or otherwise regulate healthcare practitioners, providers, suppliers. So sort of some shorthand, we do refer generally to licensing boards, but please, for those of you who are certification boards, don't mean for you to feel left out. And most of the reports that get submitted are on practitioners, but I know a number of you, for instance, pharmacy boards submit reports on pharmacies as well as pharmacists and so on. So even though our references today will mostly be about practitioners, that doesn't mean that we're not also including actions that you may take against other types of entities. So with that background, again, there are four main types of actions that your boards will take that are reportable to the data bank. And this information that I'm talking about right now is, not only right out of our statutes, but it's pretty much right out of our regulations. So first of all, the first main type of action is any adverse action taken by the licensing board as a result of a formal proceeding. Now, we've got all kinds of terms in here and all kinds of packed stuff. So you might say, what is a formal proceeding? And our regulations define all of these terms. We use the term formal proceeding very broadly in our work here at the data bank. It does not mean that it's a full evidentiary hearing. As long as you have formal, identified rules and procedures for how you do what you do, we would likely consider that to be a formal proceeding. So, again, number one, adverse actions taken by your board as a result of a formal proceeding. It could be a revocation, it could be a suspension, it could be a reprimand, any number of those kinds of things. The second type of action that would be reportable is any dismissal or closure of the formal proceeding because the healthcare practitioner may surrender his or her license, or they may leave the state or jurisdiction. An example of that would be a license surrender while under or to avoid investigation, or leaving the state while under investigation. I had worked with a state a couple of years back that faced a pretty significant predicament in that they had a practitioner who did some very, very bad things, and that practitioner absconded, took off, left the state in the middle of the board's work to take a significant action against that practitioner's license. And through some technical assistance, the board did understand that they still had an obligation to submit a report in that circumstance. The fact that the practitioner took off didn't mean that the board didn't have anything to report anymore. Practitioners running away is not a reason to not submit a report. Okay, the third type is any other loss of license or loss of certification agreement, as I said before, or the right to apply for or renew a license, whether by operation of law, voluntary surrender, non-renewal, and here's the great government language, or otherwise. Gotta love that language. So if a person has lost, the practitioner has lost his or her license, or your board has said that the practitioner cannot apply for a license or cannot renew a license, those are types of actions that are reportable. And then an example of that may be that a license, an initial license is denied for cause. You could deny a renewal of a license. You could choose to not renew a license while you are, because a practitioner is under investigation. The fourth type of action is the one that if any of you have been working with compliance officers, and probably most of you have, we've had conversations with you about the fourth type of action, any negative action or finding. And this is one that we spend a lot of time working with boards on. For a negative action or finding to be reportable It must be based on publicly available information, and the action must either be taken in conjunction with another action or related to the delivery of health care. Some of you, I know this is an orientation session, but some of you may have been around the data bank for a few years, and as Bill mentioned earlier, we used to be 2 data banks, and we're now 1, and there were some different regulations that governed the HIPDB than the NPDB. So there were some changes regarding this concept of negative action of finding. But the concepts for that, and the definition again is in our regulations for negative action of finding. The concepts are very clear. Is it publicly available? Is the action publicly available? And that in and of itself is very broadly interpreted. It doesn't mean that you post the board order on your. It doesn't necessarily mean that you post the board order on your website. It doesn't necessarily mean that you have a list of disciplinary actions on your website. It simply could be that the information is available through a FOIA request. So all of that means that it's publicly available. Okay. So is it publicly available? Is it related to the delivery of health care? That's really key. And sometimes you'll ask us, well, what does it mean to be related to the delivery of health care? And in that circumstance, we may engage in some dialogue with you about that. And one of the first questions we will say is, well, what does your Practice Act say about whether these behaviors are related to the delivery of health care in your state or your jurisdiction? And that doesn't mean that we're dodging the question. It absolutely means that we expect you to have some definitions of some of these things. And so, for instance, some states may determine that CEU, continuing education unit violations, are related to the delivery of health care, and some of you may determine that they are not. That's one where we'll have some discussion with you. So again, those are the 4 types of actions that boards take that are reportable. In terms of when actions must be reported, the new regulations simplified this answer. Actions have to be reported within 30 days of the date that the action was taken. We know that poses some challenges sometimes for some of our users because of when your boards meet and when information is finalized and so forth. But our bottom line answer is reported within 30 days. Okay, now there are a few differences in the types of reports submitted to the data bank, and I'm going to go over those in just a minute. And then the final note that I want to make is that reports are submitted in a couple of different ways. Some of you will use our Integrated Querying and Reporting Service, or IQRS, and that's basically those of you who submit one report at a time. And others of you may work through third-party software or some other program and submit reports in batch through our Query and Reporting XML service, or QRXS. So basically, those are the 2 ways that you have as options to submit reports. Okay, so now we're going to take a look and see what the system looks like for reporting. So the screen that you're looking at now is a screenshot from our website, and the first thing that you're going to be asked to do is tell us what you want to do. Are you going to start a new report? Are you going to continue a draft report? Or are you going to modify an existing report? So if you choose to start a new report, this means a brand new action, a brand new report, not a change or edit to an existing report. If you choose continue working on a draft report, this will pull up a report that you've already started. Draft reports are saved for no more than 30 days. So if you start something and don't get back to it for a couple of months, it will be lost and you will have to start all over. The third option is that you are asking to modify an existing report. Now I'm going to spend a minute now talking about modifying reports. Modifying an existing report includes correcting an existing report. So for example, if you entered a report incorrectly, you may need to change something textual about the report. For instance, maybe you misspelled a name, you entered a wrong date of action, you determined that you needed to put different information in your narrative, to change your narrative, those are corrections that you're going to make to a report. Modifying a report through a revision to action, this means that you are modifying a previously reported action. For example, a practitioner was suspended and is now being reinstated on probation. So if you think about a revision to action, a revision report is when your board's action is being revised. So you think about that as a sequence of activities. A practitioner did something to cause the board to act. You took an action, you modified that action, you're going to revise that report. You may modify it a second or third time, and each time you're going to revise the report. You're not doing a correction because you didn't make a mistake on the report. You are simply revising the report to tell another chapter of the story, so to speak, for what is going on in the interaction between your board and that practitioner. I'm sure some of you have had the experience of a practitioner appealing a decision that has been made by your board. If the action by your board is under appeal, you would modify a report and select the button that indicates that there is a notice that the action is under appeal. And that's so that a querier who gets that information, again, has more of a complete picture. And then the other thing that you can do under modify an existing report is to void a report. And I am going to emphasize as strongly as I can that voiding a report is only permitted in very specific circumstances. For instance, if the entire action should never have been reported, or if you somehow submitted a report on the wrong practitioner, or if the court overturned a board action. Please, please, please do not void reports unless it's supposed to be voided. Don't void a report when you mean to correct a report. And never, ever, never, ever, and let me say it one more time, never, ever void a report only because the subject is upset that you submitted a report on that subject. Really important. So now you know that you're submitting a report. And the next thing that you're going to, do is select an action. Again, this program is for state licensing boards, and so you're going to select a state licensure action. And because the screenshots, the screens in our system are intended to be smart and intuitive, because you are a licensing board submitting this report, that's the option you're going to see. So you don't have to be bothered with choosing from a range of other types of reports. We know you're a licensing board. The system knows you're a licensing board, and so you're going to select state licensing board. Some of you on this call may, from time to time, have to submit a nurse aid action, and there are a few of those circumstances then where you may have to use a government administrative report, which you would get to under the you see the underlined link for show additional report types. So if you have to do a government administrative report, you would get to it through that link. But again, most of you are going to stay right smack there on that state licensure link. So okay, so now you're submitting a report, and now you're going to tell us what you're doing. What are the actions that your board is taking? And you will select an adverse action code for that action. What you're seeing here on the screen is just a partial list of the adverse action codes available to choose from. There's a help link on the screen for a code directory. So if you want to see a little bit more about what these different codes mean, you could certainly use that help button. Important to note that you can select up to 5 adverse action classification codes. So for instance, you may place a person on probation, and you may fine the person. So those would be two different adverse action classification codes that you would use, and they would be submitted on the same report. Now, if you took a very complex action, and for some reason you took more than 5 types of actions, you would identify those actions beyond the first 5 that you can include in the narrative. You would include that in your narrative description. I think I've only seen that once or twice, but I have seen it. So if you have a very complex action, add the additional details in the narrative. Okay, so now you've told us what you've done, and now you're going to tell us why you've done what you've done. And this is the basis for the action. So the action is the what, the basis for the action is the why. I'm going to pause here for just a note. You will see on this screen a series of blue, and I never use the right terms. I don't know if it's a button or a link or whatever it is, but a series of buttons on the left-hand side that are links that would help you to scroll to the different sections of this report as you fill in the information. Don't get real used to seeing those because those go away with a system release that will be coming by the end of this year. Some of you have probably helped us out a great deal by participating in usability studies, usability discussions. You've given us feedback. You've said, why in the world do you do it this way? It would be much simpler if you did it that way. So whenever we get that kind of feedback, we use it. And so for those, again, if you've been around for a little while, you know that we occasionally do system updates. And our goal, of course, with all those system updates is to make life easier for you, not more difficult. So we do our best, really, to try to make it easier. So those buttons or links on the left-hand side, those lovely blue ones, are going to go away by the end of the year, and they will be replaced with 3 tabs that will be across the top of the report, which will, again, help you get to the different components of information that you'll put in. I do want to be clear that while the navigation around the reporting document will change, the substance of the report won't change. Like, you'll still include basis for action codes. You might not include them in the same place as you put them before or the same way, but you're still going to do it. So the content is, is still going to be there. Okay, and just like you can have up to 5 action codes, you can have up to 5 basis for action codes. Okay, so you've done that, and now we're going to ask you, like, just making sure that you're supposed to be submitting this report, that you're a user who's allowed to submit a report, and that all the information in the report is correct. So after you've filled out all the information, you have to certify that you're authorized to enter the report. If you have a subject database, and I don't think many of our state boards do. I think that's a function that other types of reporters use. But if you have a subject database and you've, say for instance, the subject that you've just entered a report on was in your subject database, but maybe her address changed. By clicking the box that you see here, the information that you've added on this report will update the information that you have in your subject database. Now, again, one of those changes, you'll see along the bottom of this report that there are there are 3 tabs. One of them includes validating the information. The validation tab will be one of those things that changes with the new enhancements coming by the end of the year. But again, the information will be validated as you submitted it. So now that we've seen what reporting looks like within the system, let's go over some reporting topics. Some of these may have been or are currently a thorn in your side, and hopefully this presentation will add some clarity. So first of all, let me go to the, oops, wrong thing. Okay, so choosing a field of licensure code. As you'll hear a little later in this presentation, the big changes are just around the corner that will select the most appropriate field of licensure code. This is the code that most accurately describes the occupation or profession of the subject of the report. We've noticed that many states have slightly nuanced names for similar occupation. Our codes are based on terms used most widely by the respective professions. So we really, really want you to choose the code that most closely matches your state's terminology. So for instance, it might be licensed baccalaureate social worker or baccalaureate social worker. We expect that those mean, a very similar thing. What we're trying to do is keep people to avoid the use of the term other. That doesn't help for a whole lot of reasons. And so we're trying to help you identify your field of licensure codes in a more appropriate way so that you don't feel forced to use other because we haven't given you better options. In terms of action codes, sometimes a board order will include multiple actions. Again, I mentioned earlier, you may place a person on probation and fine the person. If you're taking multiple actions, we really want to see a full report and to see all of those action codes listed. And a similar issue for the basis of action codes. These, again, tell the why about why an action was taken. Basis for action codes are grouped around general categories. For example, a group of basis for action codes is noncompliance with requirements. In an example that I've already given, the basis for action code could include violation of federal or state statutes, regulations, or rules, the A6, or failure to cooperate with board investigation, which would be 23. Again, you can use up to 5. We really, I mean, this information becomes more descriptive and it becomes more useful for the querier. The next part that I want to talk about, the next sort of, hot topic or pain point has to do with narrative. The narrative is an incredibly critical part of the report. In the 4,000 characters allotted, you tell the story of what your board did and what the subject did to bring about the board action. Details are incredibly important. Queries need this detail. So please make your reports as helpful as possible. You must not use a URL or a link to a website. It is not acceptable to simply refer the querier to a website for more information. Please provide the important details in the narrative. And I will say that if you try to put a URL in your narrative, I believe that the system will now not allow you to submit that report. It will reject the report out. Now, this is probably one of those thorns in your sides that I mentioned earlier, missing data elements. There may be times when you do not have all of the data elements required to submit a report. For example, you may not have a birth date or a year of graduation. Each time you submit a report that requires alternate data to replace what you are missing, you must contact the Customer Service Center. Each report with such alternate data gets flagged, which assists in the query process. If you have a batch of reports, please contact customer service for assistance. This is really this is a very, very important point. So you'll sometimes use the term dummy data, or you'll sometimes hear compliance staff use the term dummy data. You will be given specific values to enter in as alternate data, but you must contact customer service for that. Okay, going down our list of hot topics and pain points, the next has to do with reporting sequential actions. A board may have taken a reportable action, for example, a suspension, and 2 weeks later the board takes a second action, perhaps placing the person on probation. Both actions are related to the same underlying action by the subject. Both reports need to be submitted within 30 days. So the board has 2 options. The board can submit the first action, the suspension, as an initial report, and then submit a revision to action report for the probation. Or the board could submit both actions on one report with a very well-written narrative. Let me say that again, a very well-written narrative that explains the sequential actions taken by the board. And if you do this, you must include the multiple action codes on the report. So again, the querier has to be able to understand the story of what the practitioner did and what the board did in response through seeing those sequential actions. Okay, a word about voids versus revisions. Excuse me. Earlier you heard a discussion about the types of reports that may be submitted. Voided reports are very rare. There were only 3 acceptable reasons to void a report. The report was submitted in error, for example, against the wrong practitioner. The action that was reported did not meet the NPDB reporting requirements, or the action was overturned on appeal. That's it. If a report must be changed, for example, if you used the wrong action code or entered an incorrect Social Security number, you would submit a correction to the report but not void the report. If the board modified an earlier order on a subject, for example, a suspension was lifted, the person's license was fully restored, you would submit a revision to action report. But again, you wouldn't void the initial report. We're saying that a lot in this presentation today because, as you can imagine, it's a really critically important issue. So you might hear it a few more times before we're finished today. Now, a final point having to do with actions is actions and, as we're calling it, their packaging. Along the lines of nuanced board orders, we sometimes come across variations on a theme. For example, a private reprimand. Whether a reprimand is private, public, or just socially awkward, a reprimand is a reprimand, and it's reportable. Another example has to do with consent agreements, consent orders, or some similar agreement between the board and the subject. To be clear, our focus is not on the packaging, but we love to open up and see what's inside. And if what's inside is something that's reportable, it needs to be reported. A consent agreement could include actions such as probation, reprimand, a fine, or any number of other reportable actions. What's on the outside is not our concern. What's on the inside is our concern. We're going to talk next for a moment about reporting unlicensed practitioners, and I think this is tied to the need sometimes for alternate data. If a board takes an action to inform an unlicensed person to cease providing services, the board should report the action, a cease and desist, that is taken. If the person behaves in a way that implies to the public that the person is a professional in the field, whether or not the person uses a regulated practice title, and the board takes an action against that person for failure to obtain a license, that action should be reported. Now, sometimes I'll hear, well, I didn't have an application on the dude. How can I have all the information I need to submit a report? That's a valid concern, which is why we have the option of obtaining alternate data. That's one of those places where that does come up. Summary suspensions. This is an issue that has come up. Summary suspensions are reportable. Again, for some of you who may have been aware of reporting differences under the former HIPDB, the Healthcare Integrity and Protection Data Bank, summary suspensions under the HIPDB were not reportable, but they are reportable and they've been reportable to the NTDB. So post-merger, all state summary or emergency suspensions are reportable and do not have to be final orders. If your board takes a subsequent action following the summary or emergency suspension, you will then submit an appropriate follow-up report. Again, generally a revision to action report. Now, we've recently seen some actions that are called actions in lieu of summary suspensions. And I kind of think of the phrase, if it looks like a duck and waddles like a duck, it's probably a duck. In this case, it's probably a suspension. This is one of those board actions that was not exactly anticipated when the statutes were written. So we have to look at the intent of the law. If a board takes an action to restrict a person's ability to practice for cause, and the action does the same thing as a suspension would do, then it would be reportable. For example, a board may enter an order in which a practitioner agrees to refrain from practice until the board completes their investigation. Now, really, this accomplishes the same thing as a summary suspension, and it's reportable. And if the board takes a subsequent action following their investigation, the initial report would likely then be revised. Now, administrative suspensions, we get this a bit too, and this is sort of another one of those terms. Bottom line is they're reportable. If the board takes an action suspending a license, it's reportable regardless of the modifier, in this case, administrative. For example, if a board administratively suspends a practitioner because of a failure to pay taxes or child support, it is still a suspension that restricts practice and thus is reportable. Now, recording other name data. This is a field on the report. There are times when a practitioner may have been licensed under different names. For example, a person may have been licensed under a different name prior to marriage. Also, a practitioner may go by different versions of a first name. For example, a person may use Richard or Rick interchangeably. In order for our system to perform its matching functions well, it's important to provide as much information as possible. So if you're aware of other names that the subject practitioner has used, please add them in the appropriate fields. The other night I was reviewing actions from a particular state, and the reporter was confident that 6 of the actions were submitted, and our system, our algorithm didn't show them. And so I looked under license number, and lo and behold, I found all of them. And for some reason in this particular state, a lot of people must go by their middle names, because as I found the report and traced it back to the board order and the board minutes, all of the reports had proper first name, middle name, and last name, but the reports went by middle name. So if a person goes by a different name, please give it to us so that, again, the information in the data bank can be used most accurately. Lots of questions have come up on this next topic, reporting of deceased practitioners. So the only time a board should report a deceased practitioner is if the board took an otherwise reportable action while the practitioner was alive, and he or she dies before the report is submitted. In this case, the board should submit the report and indicate that the practitioner is deceased. Unless you are reporting an action taken while the practitioner was alive, you do not report to us when the licensed or certified practitioner dies. This is one that comes up quite a bit, denials of applications. They're reportable under certain circumstances. If the denial was for cause, then it's reportable. For example, if the applicant lied, this could result in a denial for cause and would be reportable. In most cases, denials for cause are actions taken by the board after consideration of information in the application. If an application is denied because the applicant did not meet threshold criteria, and these criteria are determined by your state and applied uniformly, then these denials are not reportable. For example, if one of the criteria required of every applicant was documentation of 1,500 hours of supervised practice, and the applicant only had 900 hours, the application would be denied for failure to meet threshold criteria and would not be reportable. So denials of applications, again, is it for cause? Is it based on threshold criteria? And you would need to determine that. And we may ask you during a compliance review, well, show us your threshold criteria. Show us what you apply to every applicant across the board. Denials of license renewals must be reported to the data bank if they are adverse actions resulting from formal proceedings. Okay, so denials of license renewals may be reportable to the data bank if they are adverse actions resulting from formal proceedings. Okay, I'm going to take just a very quick minute, because you're probably tired of listening to me, and just show you some information about what has been reported to the data bank. The slide that I think you're seeing now shows the different types of reports that are submitted to the data bank, and as you can see, almost half, 49% of the reports in the entire data bank come from you, from state licensing boards. So your work to submit accurate and complete reports to the data bank plays a huge part in the value of the data bank in keeping the healthcare, keeping people safe in our healthcare system. The next slide just quickly shows reports by profession. And based on this, you can see that about 70% of the reports are focused on 4 professions: physicians, registered nurses, practical nurses, and nursing paraprofessionals. So those of you who are boards regulating those practitioners, you're doing a great job of getting reports in. But you can also see that there are reports from a wide array of professions in the data bank. Okay, that brings me to the end of my comments, and now I'm going to take a breather, and my supervisor, Dave Loewenstein, is going to talk a little bit about our compliance reviews.
Thanks, Molly. So we conduct compliance reviews here at the data bank really because we want to ensure that the information being reported is available for those people that are querying. That's really the whole point of the data bank, right, is we want to have the folks that are querying the data bank, trying to get this information out. We want to make sure that the reports are in there. We want to make sure that if they should be there, they are there. We want to make sure that if they're there, they're as complete and accurate as possible. And so really, we do that right now for state licensing boards through two means. One, and many of you have gone through this process, is a one-to-one match. And the second is an attestation. For the one-to-one match, we find a data source. For many of you, that's your own websites. We go and look at what's on your website and compare that against what's been submitted to the data bank. And then we contact you based on any differences we find. Now, of course, we fully understand that not every action you take and may post to your website is reportable to the data bank, so we only want to ask you about those that we either know are reportable or kind of fall into kind of that gray area where some states might consider it one thing, some states might consider it another. And so we work with you at that point to get everything reported that appears to be missing, or to understand why it's not reportable to the data bank. And in some cases we find that your website may have had a mistake, and something, we've seen examples where, you know, an action had been overturned and it had never been removed from the website. We've seen actions that had the wrong practitioner name on there, and so we will do our best to help make sure that everything that should be in the data bank is actually there. The second piece is the attestation, and we ask for a proactive statement from you that, and this is done at the time you renew your registration, so a time where we're already talking to you. We ask you to attest to the professions that you regulate. We know that is, in any given state, there are always a good number of Practice Act modifications out there, and we want to make sure that we're staying current and asking you about the right professions, and that you attest that you've reported everything that you should have. We provide a list or a count of what's reported. You can look into that further, and we ask you whether that's correct and to attest that you'll continue to do the right thing. Up until this point, if we've done a one-to-one match on a certain profession that your board might be responsible for, we've had a process where you had to list the profession, but you didn't have to attest to it. It got very confusing for a lot of reasons, and crossover between different names of professions. So early next year, January, February-ish, we're hoping, we're going to be changing that, and we're going to actually have everybody attest to all their professions. It'll make it a lot cleaner. Now, at the same time, we're also putting in a bunch of other changes to the system that are going to make that attestation process a whole lot smoother for you. It's going to remember what you said last time, and it's going to make it easier for you to fill it out, and frankly, it's going to make it easier on us in looking at some of those oddball situations where maybe, you know, 3 different boards in the same state attest for one profession, and that gets us a little confused, and so we want to make sure that we're able to handle situations like that. When we do our one-to-one matches, actually we just finished one posting on October 1st. It's kind of a fairly significant milestone because we got through this process, and we called it our Top 12 framework, with all 50 states, the District of Columbia, and several territories. So over a 2-year period, we looked at many professions for all states and have posted that to our website, and I will show you how to do that in a second. From our reviews, in the past couple of years, there's thousands of reports that have been added, and those reports have been disclosed to queryers thousands of times. So we're really proud of those accomplishments and are looking forward to continuing to do compliance reviews and one-to-one matches, and we'll be in touch with you as that changes. So we'll switch over now just to show our where those reviews are posted. We're going to jump over to our public website. So to look for the compliance reviews on our website, here's our home page. We'll go to compliance. And the easiest way to do it, you can either look by state or profession. So just for simplicity's sake today, I'll look by state. We have a nice map. You can pick Illinois, kind of right where my mouse is landing right now, so I will select Illinois. And it will give a list of all of the compliance activities that we've had for the various professions, both in those one-to-one comparison projects as well as those attestations. Some of the categories here expand into others, so you can see this is all publicly available for all states. It's also downloadable information, and we'd be happy to spend some time with anybody who's interested in learning more about this or how we do our reviews.
Okay, I think we're now going to jump to the next segment, which is back to Bill around querying the data bank.
Great, thanks, Molly. We talked about reporting. Now we're going to switch gears and talk a little bit about querying. So querying, as you probably are aware, is obtaining information from the data bank. So the other half of the equation that we've been mentioning. The data bank is required by law, by the way, to be self-sufficient. So we don't receive federal appropriations, and that money comes in as query fees. And the good news for those of you that query is the fee associated with querying the data bank went down just a few weeks ago on October 1st. There is.
So you might want to pause first. Applause. Everybody's muted, so we can't hear the applause.
So actually, what Dave is saying is no joke. A lot of people are very excited about the lower query fees. And can you give the math on what the fees were? Because we don't have those on the slide, but the...
$5 for an individual and $3.25 for a continuous query enrollment.
And $8 for a self-query.
Yeah, so the self-query is now $5, and the one-time query is $3, and that's the same price for the continuous query. So speaking of continuous query, there are 3 ways to obtain a query. There's the traditional query, which is where an entity such as a licensing board just types in a practitioner's name and other information to see if there's anything in the data bank on that particular practitioner. The second way we just mentioned is continuous query, same price. You can enroll your practitioners in continuous query, and the system will automatically query the person, and send you notice if and when there is a match on something, some activity, some report activity. The benefit of continuous query is that you don't have to do anything. So if another entity reports on a practitioner that you have enrolled, you get notified automatically. The last way to query is a self-query, where an individual practitioner queries on themselves. So before we show you what's included in a query response, we want to just take a moment to discuss the benefits of querying for licensing boards. So for licensing boards, there are many benefits to querying, especially enrolling in continuous versus traditional query. Either way, by querying, you will be able to see any data that is existing for a practitioner in the data bank. You can use these reports or the fact that you get no reports to validate a practitioner's application. For example, if a practitioner says they've never had a licensure action in another state, but you obtain a query, it shows that they've had a licensure action in another state. So some entities have called querying a low-cost insurance policy, and some state boards already query because they want to, and they see the benefit. Other states have a legislative requirement to query on any practitioner obtaining a licensure or certification in the state. And just to let you know, for those states that require or are thinking of requiring a self-query response along with an application, you may need to update your guidance, as there is only one data bank now and only one query option. So an option to consider for states without the resources to query is to roll the query fee into application fees and have the board conduct the query. And we've heard a couple examples of folks that have done that. So this is a screenshot for you to take a look at. To submit is performing a query. So to submit a query, you simply access the query option after you log in to the data bank. If you were given query access, that is, and you type in the practitioner's information, if there's a match to the information you put in, you will be shown a query response. And there is an algorithm that is used to match a practitioner. It's pretty complicated, but the more information you have, the better your chances. So the more information you're able to enter on that individual, the better chances you are of seeing if there's any report matching on that practitioner. So the less, on the other hand, the less information you type in, the lower your chances of obtaining a match. If you do get a match, you'll obtain a query response, which looks like this. This is a sample query response here. You will see what actions and reports, if any, were submitted on the practitioner, on the entity, or the supplier that you entered the information on.
One of the things that is an enhancement with the query response is that we have now, the report groups actions by board or by reporting entity, and then organizes them chronologically. So, for instance, if, in this case, the Virginia State Board of Usability Testing took a series of actions against a particular practitioner, you'll see those actions grouped together under that reporting board, and you'll be able to see the chronology. The thing that we heard from queryers is that it had been difficult to kind of get the whole story about the series of reports in the data bank, and this enhancement that went into place a year or so ago has helped our queryers considerably to be able to get the whole story of what's happened between a practitioner and a board.
Thanks, Molly. Here's just a roll-up of the queries for the year calendar year 2013. So just about 5 million queries of the data bank, and this shows you who did the querying. So in terms of who queries, the majority of queries are by health plans, followed by hospitals. And state licensing agencies are fifth in terms of query volume, or about 2.3%, a little over 100,000 queries. So I guess we're going to get ready to switch gears now and talk about report forwarding, so we'll welcome Molly back to do that.
Okay, thanks, Bill. I'm just going to kind of rumble right through report forwarding because I want to make sure that we have time to show you some more resources on our website that Dave will walk through and get to more of your questions. So federal law requires that some reporting entities forward their reports not only to the data bank but to state licensing boards. And so a couple years back, we learned that some licensing boards didn't think that they were getting those reports sent to them from, say, hospitals, that licensing boards were getting reports on clinical privilege actions from hospitals. So we designed a way to have those reports sent electronically through this report forwarding process. It was implemented in 2012, excuse me, and again allows reporters who must forward a report to licensing boards to do it electronically. Two things have to happen for report forwarding to work. First, you as a board have to say, yes, we will accept the reports electronically, and you need to identify which professions or fields you license. And secondly, that the reporter must choose where to forward the report. So almost all of the licensing boards have opted in to report forwarding. There are a few who have not. Quite frankly, we want to continue to do outreach to help all of you opt in to report forwarding. Whether or not you get a report electronically through report forwarding, it is still the reporter's responsibility to assure that they provide a report to you. So if you choose not to opt in to report forwarding, you will then still have to get a copy, for instance, of a clinical privilege report by mail from the appropriate provider. And again, I'm really kind of rushing through this. So on the report forwarding screen, as you can see here, your administrator would verify the professions that your entity regulates, and then you would opt in for report forwarding. And that's important so that you only get the reports that you are entitled to get. We don't want you, through an inadvertent identification of a profession you don't regulate, to be in violation of a confidentiality or privacy or disclosure law. And so then the hospital, for instance, submits a report, and you are told then on your screen that you've got something to see, and then you will attest that you have a right to get the report, so that the report is coming in to you on somebody that you have a valid reason to get a report from. I really am only going to spend that much time on report forwarding. It's an important administrative function. If you have questions about it, forward them on. We'll be happy to work with you on it. We hope that you find it useful to get reports electronically, that it helps you get information accurately and in a timely way. So now we're going to spend a bit of our remaining time together talking about some further system updates and some cool resources. Dave?
So just some quick things on system updates. Molly talked a little bit already about the field of licensure changes. The reporting form in general is going through some streamlining to make it easier to fill out. There'll be some tabs. It'll have a little bit more of a modern look and feel. It's just going to make things easier. Specifically regarding that profession type or field of licensure, it's going to have type ahead. It's going to remember the ones you most frequently use. So if you are a board that only deals with 3 or 4 professions, those 3 or 4 professions, you won't have to sift through a whole list of lots of professions. So we hope these changes are going to, A, make our data a little better and more accurate, allow us to look nationwide a little better, but also going to make it faster on you to submit those reports. Cease and desist. So again, Molly talked a little bit about cease and desist before, but one of the things we're going to be adding, and that field of licensure change is the plan is actually to implement that later this year. We're hoping in a little more than a month or so. We'll actually reach out. Everybody that reports will be getting an email specifically about that field of licensure change because that is going to impact many of you. At the same time, we're going to add a new action code for cease and desist. I know that's been a pain point for some of you when you report cease and desist, that it is not always, it's not clear how you should do it. We've given some guidance in the past. With this upcoming release, we're going to put it right out there in front of everybody and make it its own action code, as well as prescriptive authority. This is something sometimes usually impacting boards of pharmacy, boards of medicine, could also be some boards of nursing and some others. So we're really talking about the DEA license, the prescribing authority. We've seen in the past where somebody's ability to prescribe, their DEA license, for lack of a better term, was taken away, and that was reported to us as a revocation of license by the medical board. So it looks like their medical license was revoked for somebody that may not be reading the whole report, and we just want to make sure we eliminate that confusion. And so we'll add a code there specifically for actions against the prescriptive authority that may not have impacted the rest of the license. So and we'll ask for more details there. So really we do use your feedback for the system updates that we do. We analyze calls. We really want to make the system as easy to use as possible and as clear. Certainly the harder it is on you guys to submit reports, the harder it is for queries to figure out what was going on, the harder it is for us to manage that data. So we really want to make it easy across the board. So those 3 things I talked about are coming up soon. Some more things that we're looking to do next year We're going to improve some of the self-service lookup things for resetting passwords and retrieving your user ID, retrieving your data bank ID. If you forgot any of that, we're going to be making it a lot easier to do that without having to make a phone call. You can do that yourself online. For those that query and don't have easy access or it's not easy to use a credit card every time you want to query, we're looking at some prepayment options where you can purchase credits. A big change that's coming soon also is a redesign of the self-query process. Again, just to make this a lot easier on practitioners to submit a self-query. Now, we know some of you out there require your practitioners to submit to you a self-query, and we would much prefer that you query on them yourselves, but that's okay. So if you ask them to submit a self-query, one thing we want to put a plug out there is we've seen on some of your websites and anecdotally from practitioners that they're looking for things that don't exist anymore. So they're told that by you that they need an NPDB and a HIPDB self-query. Well, there is no more HIPDB. So rather than two $8 charges for $16 now, there's one report to come out just from the NPDB, and it's only $5. If you do it, it's only $3, and you could pass that cost along to them if you wanted to. But also, so want to make sure that, and as well as some say that there must be a notarized form. That is not necessarily the case anymore either. We have a service that allows self-queryers to identify themselves online. We use one of the major credit bureaus. We don't store any of the information. We just use it as an identity proofing service. It works exactly the same. The result that the person gets will be exactly the same. So if on your websites you're saying you need HIPDB or you need something notarized, that really isn't the case anymore. And if you want help, we can certainly help you update your guidance. All right, so we'll take you back to our website. We just wanted to call out a couple of things here. One is sometimes folks ask us, well, how many reports are in the data bank? What's going on? And so we wanted to show you how to find that out yourself. So under statistical data, if you click there, it'll give you some information. There's NPDB research statistics. But what I'm going to click on is the data analysis tool. This actually gives you the ability at your fingertips to find out a lot of information. We're actually even going to be enhancing this from what you see now, but already it's a great tool that can do a lot. You can choose how you want your rows, your columns, but just very simply, if we select all the states, and let's just say we look at, 11, 12, and 13 as the action year, all practitioner types, and just state licensure reports. Click Show Results. Less than a second, I'm getting a result here showing those totals for all the different practitioner types by state. That's downloadable to Excel, and you can really use this to help figure out what's going on. You can look at other types of reports. It obviously does not get into any any identifiable information about a practitioner, but just to look nationwide, we wanted to show that. The other thing is we get a question sometimes of where are your regulations? You talk about your regulations all the time. So if you click on Resources and go to Legislation and Regulations, it's right there in front of you. The final regulations for the NPDB, that goes out to the Federal Register and would show you where those regulations are. And you can see when we talk about 60.9, what do we mean, et cetera. Going back to the home page, also some reporting flowcharts. Also under resources, and I really suggest that you spend some time looking at these resources, especially if you're a new user. There's a lot of helpful information. We actually are also in the process of looking at how can we, of redesigning our website to make it more user-friendly, to make the information available at your fingertips. Those flowcharts are under the reference library, which I just clicked. And show flowcharts. There's one right here for Databank Guide for Reporting Practitioner Licensure Actions taken by state boards. I imagine that one you'd find very useful. And so you can look here and see some very good information about what's reportable and how to go about that. We've got Lots of stuff on our news stories, etc., on our homepage. I already showed you the compliance page. One of the things we wanted to put in a plug for right now is that in the spring of 15, we are planning to do an education forum. We haven't done an education forum in a little while, and we're planning it for the D.C. area. The sessions are going to be geared towards interactive learning, so there'll be short presentations, tailored hands-on breakout sessions, opportunities to engage with staff here at the data bank and to get real-time technical assistance. So once the details are available, we'll be sharing them on our website. We'll be sharing them in our newsletter. And we look forward to seeing as many of you that can attend there. With that, as I said, we've got a lot to go through here, so thank you all so much.